Good afternoon, everyone. I'm Kristen Jandoli with Generations Health. Thank you so much for joining us for our program today, Beyond Memory Loss, Handling Personality Changes and Impulse Control Issues in Dementia, presented by Jennifer Fitzpatrick. We are so grateful to have Ingleside sponsoring today's program, and in just a moment, I'm going to invite them to join us. But first, there's a few things I want to go over with you. Everyone is muted to eliminate any background noise. However, this is an interactive program, so please feel free to ask questions, answer questions, or if you have any comments on the discussion that is taking place. To do this, you can use the chat feature at the bottom of your screen. As a reminder, to find the chat, you can scroll over the bottom of your screen, and there you will see a banner that pops up. On the banner, there is a bubble that says chat. When you click on that, the chat feature will launch and will most likely show up on the right-hand side of your screen. When you use the chat, your questions, comments, and answers will only be seen by our sponsor, our presenter, Jennifer, and myself. This is simply for privacy reasons. Again, we encourage your participation, so please use the chat feature. Jennifer is great about keeping an eye on the chat to answer your questions. As I mentioned, we're so grateful to have our sponsor, Ingleside, for today's program. At this time, to share a little information with you, I'd like to invite Kirsten Parsons from Ingleside to join me.
Thank you, Kristen. I'm going to share my screen. I have some updates and availability that I want to share, and I also want to share what's going on event-wise this month. There's quite a bit going on, so I want to make sure we go over that. Alrighty, so for those of you who are not familiar, Ingleside is a premier provider for senior living services in Northwest DC, in Rockville, Maryland, and in Woodbridge, Virginia, near the historic Occoquan area. We are not-for-profit life plan communities, meaning that we do have each level of care. What this means is independent living, assisted living, and skilled nursing all on one campus, skilled nursing including both short-term rehab and long-term care. Additionally, we have memory support neighborhoods at two of our communities. It is at the assisted living level of care. And then we also have a skilled nursing memory care unit in our community in Virginia. So our community in Northwest DC, Ingleside at Rock Creek, is our flagship community. Westminster at Lake Ridge, our community in Occoquan, Virginia, joined the Ingleside family about 30 years ago. And then Ingleside at King Farm was built in 2009. So I want to give some updates at this time regarding availability. I want to share with you at each campus what is presently available, and that's as of today. So hopefully that's right off the press. And if you are looking currently for residential options, do reach out, as I want to make sure I'm able to meet those needs. So presently at Ingleside at Rock Creek, we do not have availability in our traditional assisted living, but in our memory support model, again, it's at the assisted living level of care, but has that memory support focus. We do have 2 apartments available. Up on the left-hand side, you should see the larger studio. That's our Myrtle floor plan. And then we also have our standard studio. That's the Oak floor plan. This is at Ingleside at Rock Creek in our memory support assisted living neighborhoods. In Westminster at Lake Ridge in Occoquan, Virginia, we do have availability in our traditional assisted living, a studio style apartment. And at Ingleside at King Farm in Rockville, Maryland, I have a 1-bedroom available in our traditional assisted living. You see that here on the left side. And then I have a studio apartment in our memory support assisted living. So one other thing I want to make you aware of is our Respite Program. This is set for 30 days. It's a chance to allow someone to experience our program. It's very much like a social day program, but in a residential model. It is not intended to be just for a weekend or for a respite only for 4 or 5 days of travel. This really is an opportunity to either give true respite to the primary caregiver if they have surgeries coming up or something that mandates their focus on their own care. Sometimes it's around extended travel A lot of us are trying to do these longer trips after a couple of years of not seeing family. And then it could also be as a trial stay. So if you're saying, you know, I don't know if residential is right at this time, but I do want to try this, then that is a wonderful way to do it, is through our respite program. Again, it's a set 30-day trial period. So lastly, I want to make you aware of what's coming up this month. June tends to be a big month in terms of events and educational opportunities because of the longest day. So capitalizing on that longest day of the year, June 21st, to make note of what it would be like to live with Alzheimer's, what it's like for these individuals, us as caregivers knowing. And so the Alzheimer's Association has kind of branded that term, the longest day, to say, let's raise support on this day. Show your support, whether you're a caregiver, whether you work in the field as a professional, or whether you've just been impacted by losing someone close to you to this disease. So Ingleside at King Farm is hosting a paint and sip event on June 21st. This is a early afternoon event, 1 to 3 p.m. We will have some refreshments, and then we'll have some guided art by Patricia DeBroof. So that is at Ingleside at King Farm in Rockville, Maryland. And then the very next day, we have an in-person educational event partnered with the Alzheimer's Association. That's June 22nd at 2 p.m. And then on the right side, you'll see here that Sibley Senior Association has their annual conference coming up, and that's Saturday, June 25th. Each of these events are free. However, the paint and sip is a fundraiser, so there's a suggested donation for that event. I will send out links to register for all of these events when I send out the link for today's recording. So this is my contact information. Please do take down my cell phone number if you're presently having questions about memory support residential options or our social day program. You are welcome to text or call me, and I will put this information in the chat as well. Thanks so much for joining us today.
Thank you so much, Kirsten. We're about to get started, but first I'd like to give you a little information about our presenter. Our presenter today is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and the upcoming book, Customer Service for Healthcare Leaders. Jennifer has also been featured in national media such as Forbes, Redbook, Reader's Digest, US News and World Report, and the Huffington Post. When she's not speaking and writing, she can be found trying to resist the drive-thru at Chick-fil-A or at Macy's looking for a good deal. Please join me in welcoming, from Kent Island, Maryland, Jennifer Fitzpatrick.
Well, hello, everybody. Welcome. And I want to just say that those programs that Kirsten mentioned are wonderful opportunities, great opportunities for figuring out how to keep your brain healthy, but also to help your loved one as well. I've heard some of those speakers and they're great. So I hope you take advantage of some of those opportunities shared by Kirsten. As for today, we're going to be talking about the symptoms of dementia that I feel like are secondary, that are not as discussed. So I want everybody to really feel comfortable in that chat section to go ahead and write in any comments or questions or anything that you would like to share. If I can respond to you, I will. If I don't know the answer, I can either try to find it for you after the session, or I can go ahead and refer you to a resource that will be helpful. So this hour is all about you. Please make sure that you are writing in anything that you might like to ask. And Kristen, I think I just want to make sure that we are recording the session. Kristen, if I just want to make sure that is happening right now. It is great. Okay, perfect. Okay. So without further ado, we'll go ahead and jump in. I believe that most people out there, lay people, professionals in healthcare and mental health, they get that memory loss is part of dementia. So whether your loved one has Alzheimer's or Lewy body or frontotemporal dementia or vascular dementia, there's so many different types. But most people really can wrap their head around the concept that, okay, my loved one might not remember what season it is. They might not remember what day of the week it is. They might even sometimes forget a friend's name, a close friend's name, or a family member's name. And so as far as doing the hard work of understanding some of these other symptoms, I think for a long time, most people didn't totally understand dementia. I think a lot of that has to do with the growth that we've had in that area is the Alzheimer's Association doing so much marketing so people really understand and they're less afraid to talk about Alzheimer's disease. But the other symptoms are just as important and happen just as often. Again, like right now, one example might be not knowing there was a health crisis or forgetting about the lockdowns. That would be something that's very common with people, excuse me, right now who have Alzheimer's disease or another type of dementia. But the lack of impulse control, the lack of being able to control inhibitions, that is much, much less understood. And I think it really takes a lot of us caregivers by surprise when we see that with our loved one. So personality changes, I think most of us sort of take for granted, all right, my mom might not remember that I'm her daughter all the time. She recognizes my face, but she doesn't always remember that I'm her daughter. But when she says something rude to a server at a restaurant, that's not my mom. My mom was always so nice and so polite, and she tipped well, and she was always nice to people in public. And so what the heck is going on? What is this? But it's really important for everybody to remember that having a hard time with your impulses and your personality, having changes within your personality is very, very common with all the types of dementia. That said, it is actually typically, if your loved one has a type of frontotemporal dementia, it is often going to be the first symptom that you see. So with most of the other dementias, you're going to see memory loss be the first symptom. Now, I don't know, did anybody finish watching Grace and Frankie? If anybody's a fan of Grace and Frankie, it's a Netflix show with Jane Fonda and Lily Tomlin. And they had a very, very interesting storyline this year about dementia. This is the final season of that show. And they had one of the main characters actually started to show symptoms of dementia. And again, to me, it looked like it was probably not a frontotemporal type of dementia because the symptoms really weren't impulse control or personality changes. They were more memory loss. But even if your loved one does have Alzheimer's disease or Lewy body or vascular dementia or Creutzfeldt-Jakob disease, even if memory issues are, like in Alzheimer's, one of the most prominent symptoms early on, they still are likely to have challenges around impulse control, and you might not recognize their personality all the time. And it's very disheartening. It's very hard when somebody that we care about isn't who they always were, if their personality is really changing. So I want to take a moment to talk about how do we relate to these symptoms. And I want everybody just to think about a moment if you've ever taken a medication, if you've ever been under anesthesia, if you've ever had a few too many cocktails. Have you ever lost inhibition? So feel free to write in, or if you want to share, have you ever observed somebody in your life, a friend, a colleague, a family member, under the influence of medication or alcohol, who has lost some of their inhibitions? And I know that I certainly have observed that. For example, my sister recently shared a story. She had to have a procedure done, and she was put under a certain type of anesthesia. And she said that when she went in to get the procedure done, that they actually said to her, we need you to go and give your laptop and your phone to your husband who's waiting to drive you home after the procedure. And she says, what are you talking about? Because she has her laptop with her a lot. And they said, when you're in the recovery room, we don't want you to have access, because there have been incidences where people have picked up their phone, picked up their laptop, and they have lost all their inhibitions. That they wrote stuff to colleagues at work, responded to emails, and were very, very embarrassed later about what they had written. And so I don't know if any of you have ever had that experience. But again, same thing, like if you have a couple too many cocktails, I think we see this a lot if somebody's very, maybe they're just turning 21 and they have a drink for the first time and they don't realize maybe they're saying things that they wouldn't normally say. I don't like the way your hair looks. And you're thinking, gosh, that's very unlike this person. They're usually really polite. So what I'm trying to do, obviously, is give you an idea of probably you've observed lack of inhibitions in folks for other reasons besides that there's a brain disease going on, because drugs and alcohol medications can create that circumstance in our brain where that little voice that says, hey, that's not a good thing to say, or hey, that's going to violate social graces. I'm not going to say that, or I'm not going to do that. But here's what happens with Alzheimer's and the other types of dementia. Their brain is constantly losing the ability to control. They have less ability. If they are thinking, gosh, I really don't like that person's haircut, and somebody says, oh, what do you think of my new haircut? They might say, I don't like it. And the other piece of it that's kind of tough is because of the memory loss, they might not remember that they said it. So we have to have thicker skin. When somebody is under anesthesia and maybe writes an email that they wouldn't normally write, most of us are going to be able to forgive and forget and say, okay, well, this person didn't really know what he or she was writing. Or unless it's all the time, unless it's a situation where somebody's drinking too much alcohol on a regular basis and saying nasty things and doing nasty behavior or uncomfortable behaviors, most of us are going to be able to say, okay, I understand they had a moment with this issue. We'll forgive and forget. With Alzheimer's disease, with frontotemporal dementia, with Lewy body, with vascular dementias, all the dementias, it's really something that is going to be ongoing. Now, not every individual has this problem to a large extent. Some people have it more than others. So I want you to feel free to write in. Is there anything that anyone would like to share? Is there something in particular that you've seen with your loved one, that there was a lack of impulse control, or an issue with lack of inhibitions that embarrassed you or scared you or upset you? So feel free to write in, or if you have any questions at all, we want you to feel comfortable sharing and giving us some examples, because I want to address any concerns that you have related to this. I have found in my years of experience, and I wonder if Kirsten has had the same, this in some ways is much more jarring to family and friends and caregivers than even the memory loss can be. So it can be very, very, very stressful. So using bad language around the young kids in the family. Yeah. Oh, okay. Allison says, has there been research done on people with various mental illnesses earlier in life and the correlation to dementia coming on later in life? So Allison, there's constantly studies being done. I would be shocked if there's not a study that has examined that. But I can tell you, I don't know offhand. The exact answer to that. But what we do know is the big links are really heart disease, diabetes, having had a major head trauma, and getting older. I would be shocked if there's not studies that have. Now I know for a fact that there's some studies who have linked depression with some dementias later in life, but thus far, I don't think any of the studies are as conclusive as the ones about head injury, getting older, and then diabetes and heart disease. I'm not saying that there aren't some studies that will link mental illness with later life dementia, but there are for sure. I think there are, especially with, I know for sure depression, but I don't know that there's that many that we would say, oh, that's definitely a pretty strong link. There can be, I think there's some correlation with depression, but it's not, I don't know that the data is completely overwhelming. But to be fair, for that you were sharing, some of the physicians that are going to be from that program at Hopkins that Kirsten talked about, that she invited everybody to, there probably are some researchers there that could speak to that. So some examples, and feel free, again, write in any comments or questions at all. Yeah, thank you for taking my question. Sure, Allison. Paternal grandmother had bipolar episodes and developed dementia as she grew older. And here's the thing, Allison, with that is there's still a lot that we don't know. I feel like I've been in this field for 25 plus years, and there is so much that I think we're going to keep learning. And I think that it's possible we could find out certain medications are correlated more. I mean, we have seen some links about some drugs. So is it the bipolar? Could it be some of the medicine? Could it be other behaviors or issues that are associated with bipolar that maybe led to dementia? Or maybe your grandmother had diabetes. Maybe she had heart disease. Maybe she had head injury during the course of her life. But I know it's always interesting to examine our family history, and it's good that you're asking these questions for sure. But using bad language, this is one of the impulse control problems that really gets a lot of people very embarrassed and very stressed out. When I was a young person, actually, I remember I was in an internship in graduate school. One of my internships was in a nursing home, and in the memory care area of the nursing home, there was this fellow who he cursed. I don't get overly offended by bad language. It doesn't really bother me, but my goodness, some of the stuff coming out of this older gentleman's mouth was just stopped you in your tracks. And his family, I kid you not, would be leaving the community after visiting with tears in their eyes because they were so embarrassed. They said, "This is not our dad. This is not our grandfather. He never said anything like this. He would never speak to a nurse like this, a social worker like this. He would never say bad words in front of his daughters or his grandchildren." And so that's a really common one that we see with people who have dementia. Now, of course, we see the opposite sometimes, and this goes with the personality changes. Somebody's always been using coarse language, and now suddenly they are very quiet and just very reserved. That can happen too. But I think we tend to notice more when the personality change and the impulse control problem has to do with some rough language that is upsetting and embarrassing. And I think for this particular family, they were very religious, and it really offended them. Whereas I think some families, they might not like it, they might find it a little embarrassing, but it wouldn't be as stressful. And I think what I've observed over the years is that when we react in a strong way and we get really upset, I tend to think that it draws more attention to that behavior, and that sometimes even that behavior will be happening even more frequently. So when we see stuff, the impulse control problems that are tough, that are embarrassing to us, one of my best practices is to try not to draw too much attention to it. When we react, I think that behavior becomes illuminated, not just to others around us, but to the individual who has dementia. Quick to anger. I once worked with a family where the woman was the patient was screaming at the receptionist because they were asked to repeat something, and it was fine. The receptionist actually did not know. They weren't a neurologist or a geriatric psychiatrist. They were at the eye doctor, and the receptionist didn't know that there was memory loss. And she wasn't being impolite, but she was asking for a repeating of the information. And the spouse was just absolutely mortified. This person just went completely crazy, yelling and screaming and becoming very, very quick to anger with the receptionist because they were asked to repeat some information. And that, especially when somebody does not understand that there's a diagnosis, it can really lead to problems like, sir, I'm not going to have you talk to me like that. When somebody says that, even though they have every right to set that boundary, the receptionist should say, sir, I don't want you to speak like that to me. If the person didn't have dementia, that would be completely make sense to me. But a lot of times, that's probably not the best way to react. The best way to react might be surprising to you. In a lot of ways, the best way to react might be to apologize. I have a colleague who's a physician, and he was taking care of a gentleman once who accused him of having an affair with his spouse and was very angry, fist shaking, and the doctor said, I'm so sorry. I don't know that everybody would think to do that because it feels so counterintuitive. I didn't have an affair with the spouse. I didn't do anything wrong. I was asking the gentleman to repeat the information. But it can very much have a de-escalating effect rather than us escalating it by saying, no, 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 or sir, you really need to calm down. I mean, think about it. If you're upset or you're worked up and you don't have dementia, nobody likes to be told to calm down. It usually really isn't very productive. And I know that a lot of families find that really, but I didn't do anything wrong. I didn't, or the receptionist didn't do anything wrong. The doctor didn't do anything wrong. But it really can be de-escalating if we can humble ourselves and say, okay, her brain isn't working properly. Let's go back to the examples of lack of inhibition when someone has utilized anesthesia, medication, or alcohol. Is it a good idea? Maybe they get really, really angry, and you know that they've had too much alcohol to drink, and telling them to quiet down. Usually that's probably not going to go over too well. Maybe getting that person home, trying to get them to a place where they can rest. And again, I know that the reason I keep bringing that up is because I think a lot of us have had situations where we've been around somebody that just came out of anesthesia or had a couple of too many cocktails or took a medication that was mind altering for some reason, whether it's an anti-anxiety medicine or something that changed their mood and made their impulse control less effective. And so we know with folks like that, it's temporary. It's gonna stop. They're gonna be back to their old selves once the anesthesia wears off. The problem with somebody with dementia is probably not. In fact, in a lot of cases, it's going to get worse. So it's really important for us to practice strategies and to let people around us know there's dementia, that there's a reason why our husband is behaving like this or our father is behaving like that. The receptionist, most people that we encounter, whether it's our neighbors, whether it's our friends, whether it's other people in the family, when they know what to expect, they're going to be able to respond in a different way than somebody who doesn't understand that there's a disease going on. Again, please know, even if you've accepted, okay, my loved one struggles with inhibitions and an impulse control, or their personality is very different now, when you might accept that, but just know, even if other people know there's an Alzheimer's diagnosis, there's a frontotemporal dementia diagnosis, there's a Lewy body diagnosis, For example, Lewy body, people, okay, I understand she's going to have some tremors, she's going to have some shakiness, but she's also going to have memory problems. Understanding the part about change in personality or lack of inhibition is not something that a lot of people grasp. They need to be reminded over and over again. We can't always stop our loved ones from having those moments where they lack their inhibition, but we can control the way that we respond and that we react to that person. Again, please feel free to write in any comments, any questions about this or anything to do with your caregiving journey or what's going on with you, but especially if it has to do with any issue around inhibitions and personality changes. One that really gets people upset is when there is flirtatious behavior or romantic behavior with somebody that's considered inappropriate. So maybe the grandfather is flirting with his grandson's girlfriend. Maybe he made a comment about her appearance. Maybe he put his arm around her in a suggestive way. This again goes to lack of inhibition, that even, let's say grandpa's brain was working properly. He might think my grandson's girlfriend is beautiful, or she reminds me of an old girlfriend that I dated when I was a youngster. Well, grandpa's brain, if he has Alzheimer's or if he has frontotemporal dementia or any of the dementias, his brain is missing that piece, that connection where it says, oh yes, she's very beautiful, but of course she is my grandson's girlfriend and she's very young and it wouldn't be appropriate to tell her how gorgeous I think she is. It wouldn't be appropriate to touch her. And this is a tough one. It happens in families a lot. Sometimes that maybe a daughter looks like her mother and he thinks it's his wife and he goes to kiss her on the mouth. And this is not that somebody suddenly became incestuous. It's nothing like that. If there was never incest in the family before, if there was never any issue like that in the past, that's not what's happening. In fact, Dr. Peter Rabins and Nancy Mace, in the book, The 36-Hour Day, which is a really great book, they write about this. And Dr. Rabins has written about his experience. If families say, well, my dad is behaving in an incestuous way. No, it's really just his brain is not working properly. His brain doesn't realize that it's not okay to say or do those things. And I'm curious if anybody has ever had that sort of situation happen to them, or maybe it's happened with a staff person, a nurse at the hospital, or a doctor at the hospital, or maybe a cashier at the grocery store. I mean, and again, like there's a lot of times it's very harmless, but and it's one thing for somebody to feel like, okay, my grandfather is flirting with my girlfriend. One of the things, it just might be something just sweet and, oh, you're a beautiful girl. But if it gets to it, and you can kind of laugh it off if it's something like that, but if there's touching or if it's really making somebody uncomfortable, then maybe it needs to be examined. Should we try to keep that girlfriend away from the grandfather for a while? If it's somebody that's really, if that's possible. And I know it's not always possible. Maybe the grandfather lives with the grandson and the grandson's girlfriend comes to the house, but maybe making sure that the grandfather's not alone with the girlfriend. We have to make adaptations and adjustments in the way that we deal with this. We can't expect to have a rational, reasonable conversation with grandpa and say, listen, grandpa, Aiden's girlfriend is 15 years old and Aiden is 16 years old and you're 85 and it's really not okay for you to go and try to hold her hand. I mean, you can try that. And I always say, you can always try reasoning. You can always try having a rational conversation, but it's probably not going to work. let's go back to the person who's on anesthesia, comes out of anesthesia, they're really foggy, they're saying weird stuff. Are you going to say, hey, I don't really like that you just told me that you don't like my outfit? Because you know it's not going to be a rational, reasonable conversation. And I'm just trying to make that comparison because you've probably been in a situation where you've dealt with somebody who's had their impulse control, inhibitions compromised briefly or temporarily. This is probably going to be more ongoing. We have to find adaptive ways to deal with it. So again, if anybody has any examples, if anybody has any questions, is there anything where you've had to deal with inhibitions or impulse control problems or personality changes where you have found ways to adapt that work for you and your family? So we see poor judgment, somebody that would always wear appropriate clothing for the weather or for an occasion. Let's go through an example of maybe going to a wedding and all of a sudden you find that your loved one they show up for the wedding wearing dirty clothing or clothing that would be more appropriate to wear to a picnic than a family member's wedding. These are some of the symptoms that are outside of memory loss. She knows that she has to get dressed, but her judgment isn't quite there. And this happens with people that would never dream of going to an event where they weren't at their best, wearing makeup, wearing jewelry, wearing a beautifully dry cleaned dress with high heels. This happens a lot as somebody goes through this disease, that their judgment is not intact. Now, that said, I give you an example of my dad. My dad, when he was alive, he was never, we kind of joked that he just dressed however he wanted for every occasion. He would be the kind of guy that would wear sweatpants if you went to the Capitol Grill. And I really mean that. And he didn't have dementia. It was just the way he was. But I'm talking about somebody changing and really being different now because of this disease that's impacting them. So how are you coping? What are some ways beyond what we've talked about? You want to consider the environmental influences. So if there are certain places where you see impulse control being more of a challenge, it might be that you want to avoid some of those places. For example, it might be that when that person goes swimming, they tend to take off their bathing suit. And by the way, there's a lot of people who have Alzheimer's disease and they can still go swimming. That's still there. That's an exercise that's still good for them. But if you find that you're going to the lake, you're going to the beach, and that's a place where they begin to disrobe, or maybe they're really triggered because they're seeing a lot of people in less clothing, and that's triggering their comments, that they're making comments about people's bodies. That might be something, well, maybe we want to avoid the beach with dad right now, or maybe we want to avoid the beach when it's really crowded. You also want to be thinking about logging the behaviors and the incidents, writing down, when did this happen? Who did this happen with? Because once you start to log, and let's say it's only happening in the morning, or when they first wake up, or it's only happening late afternoon or early evening, sundowning time, that might be, okay, it's really, we need to really be on more patient, or figure out a way to make sure you have rested up for the times of day where you're going to see those behaviors exhibited. Or if there's certain people or certain foods or certain, again, we talked about environment, is there anything in particular? Watching certain television programming. It might be, for example, that you've got the news on, and that might be triggering. If you've got the news on a lot, people with memory loss, let me give you a great example. They might start talking, maybe you have CNN or MSNBC or Fox News on, and that person's brain starts to really get into talking about politics. And maybe under normal circumstances, they wouldn't talk about politics if their brain was working properly, if they didn't have dementia. And now they're saying things that are really upsetting your people that you have over at the house. That might be something you want to avoid. Maybe don't put on a news program that's talking about political issues. We often see people saying really, really insulting things about people who are different from them, whether they're different racially, culturally, gender identity, that sort of thing. Remember that the oldest old, especially the traditionalists, the generations older than baby boomers, they lived in a very different world with different terminology that was acceptable, but they also grew up with people that were more like them. Our world is much more accepting of diversity than it's ever been before. And that can be really tough too. So being really mindful of, I'm not saying that it's okay for them to be using offensive terms around other people, but I do think we have to remember that that's not them. Their impulse control, and in their long-term memory, there are certain terms that might have been acceptable back when they were younger, which is where their mind is residing. Typically, that person's long-term memory is much more intact than short-term. Take a break, step away from your loved one if you're having a hard time dealing with how they're talking or what they're saying, or the behavior that they're exhibiting. And this is, I write about this in Cruising Through Caregiving. This is why it's so important that you have a crew. Now, whether you're working with the team at Ingleside, whether you have some home care in your home, whether you have lots of friends and family and neighbors helping out, it's never a good idea for there to be one solo caregiver. Caregiving is not a solo project, especially when somebody has dementia. It is not just physically difficult, especially as the person gets more advanced with what they can't do for themselves, but it is exhausting mentally. It is mentally exhausting to be helping out your loved one and them to have moments where they're maybe saying, "Oh, you look like you gained weight." And you're thinking to yourself, yeah, I am, because I am gaining weight because I'm taking care of you and I don't have time to eat healthy food. You're going to be able to tolerate those kind of remarks a little bit more graciously if you're not the only one taking care of that person. Listen, I'm not saying that you deserve any sort of abuse, but if you've got a loved one, a parent, a spouse, an uncle, whoever it is you're caring for, and they don't have dementia and they're saying mean things to you and they're cursing at you, or you got to set a boundary. That's not okay. Don't speak to me like that. I don't want you to treat me like that. When your loved one has a dementia, rationalizing, reasoning with that person is typically not going to help you. Even if you get them in the moment to understand, 20 minutes, an hour, a day go by and they forget that you had the conversation. You want to take breaks. You want to have a lot of people helping out, whether it's utilizing a service like Ingleside offers, which it sounds like they have very limited availability, but still some availability, or you're bringing friends and family into the mix to help as part of your caregiving crew. Focus on the feelings that your loved one is exhibiting, not as much on the words or behaviors. Choose the path of least resistance. I once did a training in a senior living community, not Ingleside, but with some very lovely people in a senior living community we were talking about memory care and dementia and how to deal with impulse control problems. And one of the examples that they shared was that there was a woman who she would only want to sit in a certain chair every day. And she had advanced Alzheimer's. And I said, is there something special about that chair? Is it more comfortable? Is it easier for her to get out of? And the truth was, no. All the chairs in the room were pretty much the same type of chair. But for whatever reason, she liked this one chair. Well, the staff I said, well, what's happening if she doesn't get that chair? What happens? She's hitting people. She's using her cane to hit people. She's slapping people. This is another example of lack of inhibition. And I said, well, what are you guys doing? How are you trying to deal with that and make sure people aren't getting hit? Well, we just try to tell her that it's not her personal chair, that anyone can sit there. And I thought, you got to take the path of least resistance. This is a woman who was not violent before she had dementia, and she's not violent most of the time. She's violent when someone tells her to get up from that chair. And so it turned out that none of the other residents had this affinity for the chair. I said, why don't we just let it be? If another resident goes to sit in it, say, oh, would you mind sitting over here? And they tried it and it worked. I think sometimes we get into these power struggles of what should be, but really we want to try to choose the path of least resistance. Adjust your expectations. Your mom, your sister, your uncle, whoever it is you're caring for, your husband, they're not who they used to be. You're going to see glimpses of who they used to be sometimes and their gifts. They're not going to be the same. And somebody that was always very soft-spoken might become very loud and gregarious. Somebody that maybe had a great sense of humor and you could relate to the same types of jokes, that might not be in the cards anymore. So my recommendation is to try to adjust your expectations and know that it's not just about memory loss, especially if your loved one has any of the types of frontotemporal dementia. Early on, you're going to see impulse control problems. You're going to see personality changes. These are some of my favorite resources from the Alzheimer's Association. You go to the Alzheimer's Association, 800-272, excuse me, 3900. And you call and you ask for the Please Be Patient cards, they'll send you some. And what's great about these is if you're with a friend who doesn't really understand what's going on, or you go out for lunch, you can hand one of these to the server. You can hand this to your friend. They're really terrific cards, and they'll remind people to just, if your loved one says something insulting or rude or yells and it doesn't make any sense, that they'll maybe be a bit more gracious. I think that these are terrific, and if you just go to alz.org, or if you call 800-272-3900, you can get some of these, and I believe that they still give them out for free. So feel free to write in any questions, any comments at all that you have. We're going to turn it back over to Kirsten, and then Kristen's going to wrap us up and give you an evaluation if you'd like to give us any feedback at all. But I'm going to be here if you want to write any questions in at all, any comments, any questions. But in the meantime, I'm going to turn it over to Kirsten, but I'm still here, and your evaluation will be coming to you in the chat in a moment.
Thank you so much, Jennifer. And I actually did not know about those cards from the Alzheimer's Association. So I will be reaching out today to my contact just to see if we can get some even here at Ingleside. I want to thank each one of you for joining us today. And I'm going to put some links in the chat, 3 of them for our upcoming events. So please do copy and paste those links if anything that I shared earlier looks of interest to you. Again, 2 opportunities to come on campus at Ingleside at King Farm. The Paint and Sip fundraiser on June 21st. Then we have the Alzheimer's Association educational event on June 22nd. And then virtually, the Sibley Senior Association has their annual conference on June 25th. So I'm going to put those links in the chat. Again, thank you so much, Jennifer.
Thank you so much, Kirsten, for all the information you shared with us today. And thank you again to Ingleside for sponsoring today's program. I hope everyone enjoys the rest of their week. We look forward to seeing you again soon, and take care.